Hi there, my name is Lauren Jarvis and I'm here from the research team here at McCarro Hospital. Today I will be talking about bronchial hyperresponsiveness in asthma and OSA. I conducted a survey study to see if the asthmatic population was aware of the correlation between the three of these topics, and that if they were diagnosed with asthma, the risk of being diagnosed with OSA was increased as well. The purpose of this training video is to educate the asthma community, as well as respiratory therapists and pulmonologists, to start turning the wheels on if asthmatics could be possibly underdiagnosed with OSA. To begin, let's start off by getting a quick understanding of what each of these means individually. Bronchial hyperresponsiveness is an increase in sensitivity of airway constriction leading to an obstruction of airflow. Asthma is diagnosed via PFT with lung volumes, or FEV1s, that is decreased by 20% of normal lung function, characterized by the narrowing of the small airways. OSA is characterized by the episodes of partial or complete air collapse during sleep with desaturations. Notice the trend, they all deal with obstructive properties. Okay, so what, you might be thinking? With bronchial hyperresponsiveness being so prevalent in both asthma and OSA, there is a strong correlation between the two that may suggest that asthma patients are underdiagnosed with OSA, and vice versa. The purpose of the survey is to help collect data to see if those who are already diagnosed with asthma may be underdiagnosed with OSA, and to train providers to add OSA awareness to their practice with the asthma population and to educate the asthma population as well. Let's look at some trends that we found within the survey from our asthmatics. The first trend we found focused around symptoms and diagnosis. When asked, have you ever been medically diagnosed with asthma via PFTs, 66% of respondents said yes. When asked if their asthma symptoms got worse at night, 73% of respondents claimed that they did in fact experience nocturnal asthma symptoms. When asked if they have ever experienced any snoring, choking, gagging, or all of the above, which are classic signs and symptoms of OSA, 60% claimed that they did. Yet, when asked if they have ever been tested for OSA, only 26% claimed that they have in fact been tested. In summary of this trend, it was found that a majority of asthmatics who experience nocturnal asthma symptoms are also showing signs and symptoms of experiencing OSA. However, they have not been tested for OSA. The next trend we noticed was the level of compliance of our patients. When asked if they were compliant with their asthma medications, 80% of respondents said yes, that they were in fact compliant with their medications. For those who were tested for OSA, only 13% stated that they were compliant with their BiPAP and CPAP devices. From these numbers, it was concluded that patients tend to be more compliant with asthma treatments than OSA patients with their CPAP devices. If patients were educated more on the fact that their CPAP and BiPAP devices could help relieve their bronchial hyperresponsiveness due to their asthma, would they be more compliant? That brings us to our third noticeable trend in our survey study, and that was on patient education. When asked if their doctors have ever mentioned having an increased risk for OSA to their bronchial hyperresponsiveness and their asthma diagnosis, 80% of respondents claimed that they had never been informed on this. At the end of our survey, we asked respondents if they would be interested in receiving information on this topic, and 60% stated that they would be interested. But we'll keep that part confidential to protect our respondents' information. At the end of the day, it was evident that the patients are in fact curious, and that shows willingness to grow and learn more about their conditions. In conclusion of all these trends, it became clear that patients with asthma are in fact severely underdiagnosed with OSA. The purpose of this training video and from the survey was to encourage respiratory therapists and pulmonologists to add OSA screening questionnaires to their practice, and to help begin turning the wheels in the asthmatic population's minds to think about their nocturnal symptoms, and to help in the underdiagnosis of OSA in the asthma population. With the right encouragement and patient education from our fellow respiratory therapists and pulmonologists, we can help the asthmatic community understand why they may be feeling the way they do at night, and that it is in fact not just uncontrollable asthma, and that it is in fact bronchial hyperresponsiveness that triggers their nighttime symptoms. With all that being said, please feel free to contact me with any comments, questions, or concerns. I would love to work with each and every one of you to advocate for our asthmatic community. Thank you for listening, and have a nice day.